What's up guys, in this video today we are going to discuss about staphylococcus and streptococcus, which are a gram-positive cocci bacteria. First we will discuss about staphylococcus, later on we will discuss about streptococcus. If you like this video, please hit the like button and comment on the comment section, and please subscribe this channel. It really helps us to make more video. Thank you for your support. Let's go. Gram-positive cocci bacteria are spherical bacterial shaped like a ball and called cocci, and a single bacterium is called coccus. Example: staphylococcus and streptococcus. Gram-positive cocci of veterinary importance and medical importance include staphylococcus and streptococcus. Staphylococcus species are a gram-positive cocci arranged in a cluster bunch of grubs. Those bacteria are non-motile, 0.5 to 1.5 nanometer diameter. Those are really small in size. They are facultative anaerobic, they are fermentative, they are catalase positive and oxidase negative. Growth occur in nutrient and blood agar but not on McConkey agar. Those bacteria do not grow on McConkey agar. On McConkey agar, the bacteria which are a gram-negative bacteria can grow on McConkey, but staphylococcus are a gram-positive bacteria, so it does not grow on McConkey agar. The pathogenic staphylococcus are coagulase positive. The pathogenic staphylococcus are coagulase positive, but the non-pathogenic staphylococcus are coagulase negative. The coagulase tests correlate well with pathogenicity. There are also non-pathogenic species of staphylococcus. The non-pathogenic species occur as a commensales and in the environment. They cause opportunistic infection in human beings and occasionally in animals. The non-pathogenic staphylococcus can cause a disease when the animal is immunocompromised, or it will affected by other disease. In that time, the non-pathogenic staphylococcus can cause opportunistic infection in human and also in animals. The pathogenic species of staphylococcus are Staphylococcus aureus, Staphylococcus intermedius. Most strains of Staphylococcus aureus are a pathogenic species of Staphylococcus, but the commensales or really opportunistic pathogenic are Staphylococcus epidermidis, Staphylococcus saprophytics are a species of opportunistic pathogenic, or those species of bacteria are a commensales types of Staphylococcus. There are other non-pathogenic cocci that could be confused with coagulase negative staphylococcus. These are macrococci and enterococci. Pathogenesis and pathogenicity. Coagulase positive staphylococcus, those bacteria which can cause a disease, are a coagulase positive staphylococcus, which are Staphylococcus aureus, Staphylococcus intermedius, and Staphylococcus aureus are virulent, whereas coagulase negative staphylococcus, which are non-pathogenic staphylococcus, which are Staphylococcus epidermidis and Staphylococcus saprophyticus, are less virulent. Coagulase negative staphylococcus are commensales. They may cause opportunistic infection. We will discuss first. Species associated with animal disease are Staphylococcus aureus, Staphylococcus intermedius, Staphylococcus epidermis, and Staphylococcus saprophytic. Those bacteria can cause a disease in the animal. Staphylococcus aureus, most pathogenic and cause different spectrum of disease. Those diseases are wound infection, mastitis, skin and joint infection can caused by Staphylococcus aureus. In Staphylococcus intermedius, cause pyodermal endometritis, cystis, suppurative condition in dog and cat. Staphylococcus epidermis and Staphylococcus saprophytic, since they are opportunistic microbes, rarely they may cause bacteremia, endocarditis, UTI, surgical wound. Staphylococcus are pyogenic microorganisms. They are pus-forming microorganisms. Pyogenicity results in the formation of abscess and suppurative. What is the difference between abscess and pus? In chronic staphylococcus wound infection, they may cause botryomycosis. Botryomycosis is granulomatous lesion with pocket of pus throughout the tissue. Pathogenicity of pathogenic staphylococcus is due to production of plenty of toxin and enzyme. Important toxin of staphylococcus which play an important role in pathogenesis are enterotoxin, exfoliating, toxin shock syndrome toxin, epidermolytic toxin, alpha toxin, and leucocydin. Those toxins which produced by staphylococcus, those are important role. They have important role in the pathogenesis of staphylococcus. Enterotoxin A up to E involved in human food poisoning. Exfoliating produces staphylococcus scalded skin syndrome, can cause scalded skin syndrome. Staphylococcus scalded skin syndrome, which caused by exfoliating. Toxin shock syndrome, toxin cause a toxic shock syndrome in human being, can cause a toxic shock syndrome in human being by the toxin shock syndrome toxin. Epidermolytic toxin cause exudative epidermitis. Alpha toxin hemolysis is associated with gangrenous mastitis in cattle. Leucocydin kill neutrophil and macrophage of cattle, rabbits, and human. Protein A, surface component of most strain of virulent Staphylococcus aureus, bind to the Fc region of immunoglobulin G and may play a part in the pathogenesis of staphylococcal disease. In addition of exotoxins, pathogenic Staphylococcus produce enterotoxin. There are 8 serological distinct enterotoxin, A up to E, G up to I, associated with food poisoning in human, are heat stable, resistance to gastric duodenum enzyme produced by 13 to 15% strains, act as superantigen, activate mast cell to release mediator vomiting. The enzymes which are produced by pathogenic Staphylococcus are staphylokinase is a plasminogen activator, cause coagulation of plasma in vitro. The enzyme which are produced by pathogenic Staphylococcus, which only produced by pathogenic Staphylococcus, does not produce by non-pathogenic Staphylococcus. Because of this, the pathogenic Staphylococcus can cause coagulation in the plasma, in the coagulase test. The second enzyme which produced by pathogenic Staphylococcus are hyaluronidase. It is a spreading factor. Other enzymes which produced by pathogenic Staphylococcus are lipase, coagulase, protease, nuclease, urease. Those enzymes have a great role in pathogenicity of Staphylococcus infection. Thanks for watching this video. Please subscribe this channel and support us by sharing this video for us.